Why can't a modern, incredibly wealthy society provide world-class hospitals and elite public schools for every single citizen at the exact same time? The answer comes down to scarcity. Human desires for goods, services, and high living standards are virtually infinite, but the physical resources required to build and maintain them, land, raw materials, and human labor, are strictly limited. Because these resources are finite, a national budget cannot operate like an unlimited shopping list. It acts as a ledger of unavoidable zero-sum choices. Every tax dollar spent, every brick laid, and every specialized worker trained to build a new high school is a resource that is permanently unavailable to staff an emergency room or save lives in a hospital. Economists call this harsh reality opportunity cost. The true price of any societal decision is the exact value of the alternative you have to give up to achieve it. This graph illustrates those trade-offs, the production possibilities frontier. Healthcare is on the vertical axis, education on the horizontal. Look at point A at the top left. This represents an extreme where society allocates 100% of resources to healthcare, leaving zero for education. In this scenario, citizens might receive daily checkups and unlimited cosmetic surgeries, but there are no schools, no teachers, and no one knows how to read. Now look at the exact opposite extreme down at point F. Here, society places all of its resources into the education system, completely defunding healthcare. Achieving perfect schools in this world means converting intensive care units into kindergartens and forcing highly trained heart surgeons to teach high school biology. We never see societies operating at these outer edges. Completely abandoning either of these critical sectors leads to rapid, catastrophic failure. Notice a crucial mathematical detail here. The line connecting these two extremes is not a straight diagonal, it bows outward. This curve is driven by the law of diminishing marginal returns. Starting near the top, diverting resources toward education yields massive learning gains for almost no drop in health quality. But at the bottom, squeezing out a tiny improvement in test scores requires sacrificing massive amounts of medical care. This shape proves that opportunity costs skyrocket at the margins. Chasing absolute perfection in one sector inherently creates immense, deadly inefficiency in the other. In reality, governments navigate this curve by pumping massive amounts of capital into both sectors simultaneously, aiming somewhere toward the middle. This chart tracks state and local spending. The bottom trend line shows education funding consistently hovering around 4 to 5% of total GDP for decades. That translates to nearly $1 trillion spent annually on schools and universities. This pie chart breaks down Medicaid spending. The large purple and blue slices on the right show massive portions of this budget are allocated specifically to care for the elderly, the blind, and the disabled, consuming huge federal resources. Yet, despite these staggering budgets, United States standardized test scores have largely stagnated, and overall life expectancy trails behind many peer nations. The data reflects the model's exact warning. Simply throwing more money at the edges of the curve without structural innovation eventually hits the unbreakable wall of diminishing returns. Everyday society is a constant negotiation. We are continually forced to balance our budget constraints somewhere along the middle of this curve, based entirely on our current values. On our current economic trajectory, having more of everything is mathematically impossible. So, are we permanently trapped by this exact set of limitations? Not necessarily. While we cannot escape the curve today, over time, we have the ability to push the entire boundary outward. This outward expansion happens through division of labor, rapid technological innovation, and positive feedback loops created by a highly educated workforce. This outward shift is economic growth. It is the engine of human progress, and it is the only way a future society will be able to afford both better schools and better hospitals than we could ever manage today.